It's just top of the hour. I'm going to give a minute or two before we formally begin. Welcome, everybody. I see people still joining the meeting, so I'll just give a minute or two, and we'll start. Thank you. We'll get started, Andrew, unless you are against that. I think I'll get going here. And if I might ask, I don't know when people are going to get on for presentations, but so you can see videos. I know you're on at the time of your own presentations, but thank you all for being here. I'm Mayor John Hamilton, and I want to just get started for this, our 2022 version of the annual report, now our 6th annual report on the state of public safety, this covering the year 2021. Thank all of you for being here, media, city council members, members of the administration, public safety workers, and interested parties. Very much thank you for being here. This continues our administration's tradition of transparency and accountability by sharing this annual report about public safety. You will hear shortly from Fire Chief Jason Moore, and then Police Chief Mike Diekhoff, and then Department of Community and Family Resources Director Beverly Calender-Anderson. And as we get into that, I do want to just note a couple things. First, of course, keeping the public safe is a most fundamental obligation of city government and a service that we provide. I want directly from myself, from the administration, from all of the people and visitors of Bloomington to thank the 300 public safety workers of our city who are dedicated, who are professional, who are well-trained and well-led and active every day for our community. It has been a difficult 2021, as we all have experienced. Certainly the pandemic has affected us again for a full year, including in ways directly to our public safety services, as well as, of course, the way it affected our community and the stress that it put on our community, which our public safety folks deal with every day directly. I am very, very proud of the work of our public safety departments that they've done in 2021, 365 days of that year, 24 hours of every day. You will hear today about another year with 0 fire fatalities in our city. That's a very basic measure, and we're proud of that. You will hear today as well about another year with declining crime rates. That is also a very basic accomplishment. True across the board for crime, 6 out of 7 major categories, and a reduction in violent crime. You will also hear today about intensive interventions with those in our community experiencing difficulties with housing, with income, with access to health care, with basic needs, helping folks deal with those situations. Today, you will also hear about a dramatic increase in just the number of fire calls answered by our fire department. You will also hear about an increase of great concern in gun violence in our community and our responses to that. You will also hear about increased investments in our social safety net, and you will hear about challenges that continue in hiring and retaining staff and our responses to that. You will also, I believe, see that we believe in training in the Bloomington city government in public safety, an ongoing commitment to the best training to equip our staff and ensure the best outcomes and their wellness. You will also see we believe in innovation, how we expand into new approaches, continuing that tradition in our city, integrating our work across a whole spectrum of public safety, breaking down silos, increasing the range of work that we do with social workers, with community service specialists, with the Stride Center, with the After Hours Ambassador, the Future Policing Task Force, and others. And you will also, I believe, see our commitment to quality. We are in Bloomington, Indiana, the only city in Indiana with a CALEA nationally accredited police department and a #1 ISO rating fire department. I just want to repeat that. We are the only city in Indiana with both a CALEA accredited police department and an ISO 1 rated fire department. We are extremely proud of that fact, and it demonstrates our commitment to quality together. Let me turn it over for the main presenters of the show. You will hear from 3 outstanding public safety leaders. First, you'll hear from Fire Chief Jason Moore, and then from Police Chief Mike Diekhoff, and then from Community and Family Resources Department Director Beverly Calender-Anderson. We'd be happy to take questions after those presentations. And I turn it over to you, Chief Moore. Thanks very much.
Thank you, Mayor Hamilton. I'm going to share my screen. So thank you all for coming. I'm really proud of our department, not only just from year to year, but also 2021. There were a lot of challenges that the pandemic continued to bring to our department. We also had the biggest turnover that we've ever had, which meant the largest recruit class. So that did lead to a lot of extra overtime and a lot of challenges that we've never dealt with. I don't know, things like floods. So I will get into our presentation, and I just want to make sure that first and foremost, I thank our firefighters for the work they do every day, 24 hours a day, 7 days a week, 365 days a year. I am a city resident, and I am proud to know that this department protects my family, and I hope you are all just as proud of your department as I am. So what is our mission? I do this with budget presentations. I do this all the time, but I really don't have to read this screen, but we provide excellent public safety. And we do that with fire prevention, public education, and emergency management mitigation. I will point out that starting in 2022, we will probably have to readjust our mission slightly because we are entering into that world of that social service network with some new positions and some new things that we're getting into, which we'll discuss later. So for our personnel, in 2021, we were at 110 full-time employees. That is 3 full-time prevention, 1 full-time for training, 102 full-time, which is 34 per shift. There's 3 shifts. For the operations, that's the big red trucks. That's the one who are responding to the calls. And for administration, there's 4 full-time employees. I will point out in 2022 that we were given technically 3.5 positions, but it's 4 new positions. We will have a part-time administrative assistant, an assistant chief of administration and planning, and then 2 community care coordinators. And again, I'll talk about the community care coordinators more in depth, but we are very excited about the additional staffing in 2022, which will help us tackle some of the challenges that we're going to talk about in this presentation today. For our diversity of our department, the diversity profile, we have 5.5% female. We still are a male-dominated career field. And I do point out that we have 0 that have self-identified as other. And 1 hiring, we talked about the largest recruit class, but it was also the most diverse recruit class that we've ever had in our history. So we went from 1.8% BIPOC to 5.4% BIPOC personnel with one hiring. And we are aware of 2 that have identified as LGBTQ+. So again, we're making strides, but the work is not done and we still have a long way to go. So this is still an initiative. This is still something we are focusing on, and we are still looking on how we can balance this department and truly match the community we serve. For our fire stations, unfortunately, last year when I did this, we were at 3 stations that were in the realm of needing replacement from an engineering study. And due to the flood, Station 1, our main headquarters station, is still out of service. So you will see there is a new light blue dot. It's our temporary Station 1. I really have to thank all of the staff, the mayor's office, everyone that came together that helped us go from being without a home to having this temporary station up and fully running. I believe it was about 6 weeks before it was fully up and running, but within about a week of the flood itself, we had already found a new location and we were already operating out of that station. But again, a huge challenge for us. I've got a few pictures of what that flood did to that station, but we are now in the process of evaluating a new Station 1 as well, figuring out what is the best site location, what's the best option, and what's the most fiscally responsible option for taking care of that need. But as of right now, there were no service delays, no service delivery issues. We were back up and running very quickly. But when you get into it, we did have to displace the crews that were here. And even our temporary station is not large enough to house the same crews that were at the current main headquarters. So we did make some changes to help balance out fire protection around the city. And one of those big ones is the 100-foot platform aerial that was downtown had to go out to Station 2, which is on the west side. And to make sure that we did not just leave a vacancy of aerial coverage for the city, we did move the 100-foot straight aerial over to the east side station. So we now have an aerial on both sides of the city that can come together in the middle, which is actually working out very well for us. Here's some pictures of the aftermath. The first picture is the day of the flood. Going back in, the entire basement was flooded. And what you can see on the right is what was down in that basement. It's workout equipment, but behind that wall is where the nerve of that building, the nerve center, all the electrical, the communications, everything that helped that building run and be able to provide service was in there. And it did cause substantial damage. We are still dealing with the insurance claim process and some of the other issues that have come up from that. But again, just because that one closed doesn't mean that we had to discontinue service. We just rolled with it and found a new place, and we're back up and running and still providing service. The COVID-19 pandemic effects continued in 2021. I just want to point out that we are still a big part of the continuity for city government team, helping making those decisions to keep the city up and running safely for the employees and for the people that are interacting with us. We continue partnerships for vaccinations, but it did delay or disrupt several of our goals. There's a lot of the things that we do in this department that require that in-person interaction. And with everything that is going on, it was really difficult to get some of those goals completed. So continuing on, in 2021, we had 20 positive COVID-19 tests, 178 negative COVID-19 tests. And the one thing that I'm really proud of is that we helped administer 491 COVID vaccines. So this was a big change where we added a scope of care, adding vaccinations to our capabilities. And a lot of those 491 vaccines were given to people that otherwise couldn't have gotten it because they couldn't get out of their homes, or some of the at-risk population groups. So I'm really proud of our department for pulling together and being able to add that benefit to the community. And again, just helping with this pandemic in any way we can. For prevention, we talk about our 3 E's: education, enforcement, and engineering. So for education, this one suffered as far as our goal quite a bit because how do you educate people when you can't be physically in front of them? But we did have almost 1,700 community contacts, which station tours is not something we do a lot of with the pandemic protocols. But we did get out, we did get into some schools, we did do some very planned and calculated risk type engagement activities to continue that education and help with the fire prevention. Enforcement, there were 398 fire inspections, 533 pre-plans, and 28 fire investigations. Those numbers are way down, but we were also without one of our fire inspection personnel for a vast majority of the year. And for engineering, that's the plan review. As you can tell, just driving around this community, it is growing. There's constantly new things going up. And that plan review process is how we help prevent anything from becoming a fire hazard by making sure it's properly built in the first place. For training, again, you heard Mayor Hamilton say that we pride ourselves on this. So for 2021, we had just over 43,000 hours, which is 102% of the goal. We do reoccurring, which is how we maintain and keep fresh on our skills. New certifications, again, with our largest recruit class, that was a number quite higher than what we're normally used to seeing. But making sure that your firefighters are properly credentialed, that they have the training and certifications necessary to do the jobs that we're asking them to do. Physical fitness, since I've been the chief here, we've really invested in our employee health and safety between annual physicals, physical fitness, having workout facilities, and then partnering with BPD to have an athletic trainer is something that we're really, really excited to get started with. I know they've had it for a year, and we're looking forward to getting it started this year. And then other specialties, all those other things that we have to do, we make sure we provide training on that as well. So here's something that Mayor Hamilton talked about, our operations, the calls. The red line, you can see, it is way above historic averages, and we've got several years running there. We did see a major shift, and I'll get into this, where you can see 37% call increase. That is unprecedented for this city. That is unprecedented for a lot of areas. Talking to my peers around the nation, almost everyone has seen a substantial call increase, generally somewhere in the realm of 17 to 20%. So 37% is something that we were not expecting. You can tell from this that there were major increases in the rescue EMS. That could really come back to a lot of the COVID, where people are having issues that are turning into bigger problems where they call for 911. And the false alarms, again, it's something that we are working on, but we don't have a lot of tools to address that. So we are moving a 2021 goal into 2022, which is to get a fire ordinance update where we can start addressing the false alarms better. Fires did go up about, just a little under 10%. And again, we've had really good outcomes, but we did have basically an overall increase in calls that is completely unprecedented. And tie that in with the extra overtime and all the being short did put a lot of strain on our personnel. And again, I want to thank them for the job they do. For IU, we always kind of subsect this out and talk about what is the impact from IU on us. You can see that while they did have increases this year, they kind of stayed along with their normal trends that we see. So there were increases with IU as well, not quite as dramatic as what we saw with the rest of the city, but there were quite a few. And the false alarms is one of them that we're really concerned about. We've gotten really good about taking care of the big emergencies that might actually kill someone. So our focus needs to start getting onto these calls that are detracting and preventing us from being available for those more serious calls. Last year, I reported our response times with this type of metric. And thanks to Dave Askins, he pointed out a flaw in that metric. So I wanted to make sure I reported it because this was still a goal. But I also want to use the next screen to kind of show what we're going to be doing from now on and how that looked in 2021 compared to where we're going in 2022. So in 2021, we were on scene within 4 minutes, 72% of the time. The goal was supposed to be 90% at 4.5 minutes. I'm sorry, so it was 72% of the time for 4.5 minutes. So 90% of the time, and then 8 minutes, 98% of the time. So we fell short of both of those goals. I will tell you when we talk about why, there's a lot of construction activities, so we can't control, when the roads are closed, if they're, delayed speed limit things, extra traffic calming devices that are added, the orange barrels. We did have multiple instances this year for one of the first times it really was kind of an impact is simultaneous calls for service. And we did still have some calls that were outside of that 1.5 miles of within a station that do cause some of those delays. Moving forward, these are the metrics we will be using in 2022, but I also kind of did the analysis for all of last year to see how we were doing. We are going to be following the national standards, which is the NFPA 1710, that's the National Fire Protection Association, and it does outline how a department can be successful. The closer to these goals you get, generally the more successful you can be. So turnout time is the time from when we receive the call until we get on the truck and we leave the station. We're looking at 80 seconds or less for fire calls, that's structure fires, and other calls. The reason why you take more time for that as opposed to the emergency medical side, which is the 60 seconds, is you have to put on the extra gear. For first arriving, that's how quickly we can get that first unit on scene. For fire and EMS, which is emergency medical calls, we're looking at the 4 minutes, so the 240 seconds or less. And for the other calls, you have a little bit longer, that's 300 seconds. The total response force, which is defined by ISO, is the first 2 engines and the first aerial that responds to a structure fire call. We're looking at that 480 seconds. So, getting into everything that we have going on, this isn't something that looks great, but this is, what Mayor Hamilton talks about, transparency, not just reporting the good, but reporting the things that we need to improve on. So you can see for our fire turnout time, we're at 139 seconds. For the first arriving engine to get on a fire call, 294 seconds. And then for the total response force, 508 seconds. And again, this looks at every call from 2021 that is classified as a structure fire call. For the emergency medical, we are at 135 seconds for our turnout time and 369 seconds for our first arriving. And then for the others, 137 seconds for turnout and for 372 seconds for the first arriving. So when we talk about not meeting a goal, obviously this wasn't the goal in 2021. For 2022, moving forward, that's kind of our baseline, that we are below what we want to be. And we always talk about how do you fix that. So one of those new positions, the Assistant Chief of Administration and Planning, will give us some additional oversight where we can start digging into the why. So we may find out that a lot of cities that have done the why studies as to why we're not meeting these, that maybe it's poor station design. A great example that I've given to someone when Chicago did this type of study is they realized if they added just a few more urinals, that it was, not being able to run to the restroom before you go on a call real quick was causing a delay. So we're going to be digging into the why in 2022 so that we can start bringing these goals in alignment with where we're trying to be. Mayor Hamilton said that he was proud of this, and I am too. For the 5th year in a row, we've had 0 fire cause fatalities. You will see also that we've had a slight uptick in 2020 and now 2021 of fire calls. I think a lot of that directly correlates to the prevention activities. If you can't go out and inspect, you're not finding these issues, they turn into fires. So 2022, we're really trying to get back on track and get some of the prevention activities back online so that we can continue to drive those fire calls down and, again, drop the community loss and the potential of someone dying in the city. I am extremely proud of this, although I will tell you, we don't chase the award, we chase the improvement of service, which is what has allowed us to get to the best ISO rating that is out there, which is a 1 or 1X. So we are one of 2 cities in Indiana. There are now 4 ISO 1s in the state, but that puts us in the top point percentages. We're not even the top 1% anymore. We're above that of rated departments in the United States. And we are one of 4 departments out of, I think, around 766 departments in the state of Indiana that are rated as a class 1. So I will tell you that this is not just our achievement. This also reflects on the 911 Dispatch Center and CBU, the City of Bloomington Utilities, who provides our water for our hydrants and for the fire protection that we do provide. So again, a lot of work went into this, but the work was built to provide better service, and we are proud of this being the outcome of that better work. Another thing that NFPA 1710 discusses, not only just the response times, but it kind of gives you a guideline of how many firefighters should be on a scene. This has not changed. We didn't add any line firefighters. So for a single family home, we have plenty of firefighters to manage that risk. When you get into the strip mall, some of those commercial occupancies, we are not necessarily there as far as what we need. We can recall, we can add additional resources or call for mutual aid for those. And if we get into the high rise, which is those 7+ story buildings, you see there is a pretty big deficit of what we need. which is why fire prevention activities in those types of buildings are very important, and why we also really push to have that pre-planning and that plan review done so that these are built with the mindset of trying to keep the fire in check before we get there. For our annual operating budget in 2021, we were just over $12 million, which is almost $1 million less than 2020. Before anyone gets upset, because we're not, the big difference between that is when we do big purchases. So in 2020, we bought the aerial that's being pushed in the picture there, which is $1.2 million. So we still had plenty of money to do what we needed to do, but we didn't need to buy one of those $1 million apparatus, which is why it looks like there was less funding that year. This big apparatus that got pushed in was one of the last bigger apparatus. In fact, the final frontline fleet apparatus that had to be replaced for the capital replacement plan. We are moving into looking at the stations and some other issues that are also capital issues, but not necessarily as easy to deal with as buying fire apparatus. So in 2021, we had that 100-foot aerial delivered and pushed it in. We ordered 3 staff vehicles, which if you have tried to buy a vehicle anytime recently, you can understand that a lot of these are on back order. And we did order a mobile air cart, which will enhance our capabilities and allow us to remain on a scene longer and kind of reduce some of the stress of some of the fires that are bigger where we have to move air back and forth for our firefighters to breathe. For projects, we had a due diligence for Station 3 replacement. Hopefully there'll be more to come of that here in the near future. We did participate in COVID vaccination clinics, the flood aftermath, not only our own issues, but helping the community with their issues. We worked on a 5-year strategic plan. That was one of the COVID delayed issues. So we did get internal stakeholder feedback, which we still need to kind of complete. And then we are going to push that into 2022 because it is important that we have kind of a written guide of where we're heading. And you can see the picture here. This was a city-led, but we did provide diversity and inclusion training for all of our firefighters. Not only as a department, we had a trainer come in, but also city-led. We had additional diversity and inclusion training. 2021 goals. We did meet our annual training goal. We did not hit the 1 prevention contact. Again, we were down a fire inspection person for pretty much most of the year. We only got 38% of that goal completed. We did get the replacing the outdated equipment done. The response goals, we did not meet our goal. We are realigning those goals, and we are trying to make sure that we continually get better. We did get the diversity inclusion training done. And then part of our thing is how do we get better? We have to do an analysis. We did get 100% of large incidents where we analyzed it, looked at what went right, what went wrong. We had a goal of getting 30% of the minor incidents, and we only got 21% of those analyzed. But again, with the new position, we're hoping that we'll meet that goal. For 2022, again, these are not all of our goals, but I want to make sure I touch on them. We want to continue to meet those updated response and training goals. We do want to get that prevention contact with every commercial occupancy. I will be hopefully heading to City Council once we get through the state process to update our city fire ordinances. That'll give us those tools to reduce those false alarms. I want to complete the 5-year strategic plan and have it published. And we are adding the new positions of community care coordinators, the assistant deputy chief, and the admin assistant. The community care coordinators, very briefly, are people that we're going to be putting in place. They are non-sworn firefighters. They are there to kind of look at some of our high demand, what we call customers in our world, but high demand patients. So people that use the 911 service a lot. Is supposed to be a safety net, not the net, not the only thing that you call when you're having issues. So this is part of that mobile integrated healthcare system that we are trying to get online this year, where we partner with the hospital, we partner with mental health professionals, we partner with a lot of the continuity of care things that need to happen. And then we follow up on those people so they don't slip through the cracks and then end up as a 911 call or a death. So inclusion for mine, we are very proud that we have protected the city for more than 120 years. And I am extremely proud of our firefighters and everything they do for you and for us every single day. And I think with that, I will be introducing Chief Mike Diekhoff, who will be presenting his.
Good morning. Welcome to my presentation. Thank you, Mary Hamilton, for hosting this today. I want to start off by thanking all of the men and women who work for the Bloomington Police Department. They're out there every day patrolling. Not only are the officers extremely important, but our dispatchers and our records clerks are also extremely important. Those dispatchers are your first contact with public safety for police, fire, and ambulance, and they work hard every day to maintain that level of professionalism and that safety net to make sure that everybody is served with public safety. Go over our organizational chart. We are authorized 105 sworn personnel. We currently are at 85. You can see the breakdown is 74 male, 11 female. We have 76 officers who are white, 5 African Americans, 3 Latinos, and 1 Asian. Our non-sworn personnel, we are authorized 59. We are currently at 45. We have 8 males and 51 females, and the breakdown is 39 white, 3 Latino, 2 Asian, and 1 African American. Our organizational chart is laid out under sworn and non-sworn. I have captains over each of those divisions, and you can see that the sworn division is your uniformed police officers and your detectives, and the administration, the non-sworn, is dispatch records, and we have our CALIA people in there. We have our social workers under the non-sworn unit also, for a total of 164 total personnel. Talk about training. Our training division conducted over 9,535 hours of in-service training in 2021. That's 4 times what is required by the state of Indiana per officer. We did a lot of different types of training. You can see on the right-hand side of the screen the types of training that we did. The one that I want to kind of highlight is one that we started this year that is new, called Icat Training. It's integrating communications, assessment, and tactics. It's a de-escalation training. It's evidence-based, and it's put on and developed by the Police Executive Research Forum. They're an international leader in police training and policy. This is something that they have started a few years ago and are pushing out amongst law enforcement agencies. We instituted that training this year. And as I stated earlier, it is evidence-based, and they have shown that it has it's proven to de-escalate situations. And so we had all of our officers go through that. I also want to highlight, we did quite a bit of implicit bias training, and made sure that our officers also had a lot of the mental health first aid training, because we deal with a lot of people who have mental health issues. Next, talk about hiring in 2021. We hired 9 new officers in 2021 to replace officers who either retired or left the agency. In that group, 4 were previously certified and immediately started in our FTO program. The other 5 officers had to attend the Indiana Law Enforcement Academy, and after they graduated, they entered the FTO program as well. Talk a little bit about crime. We're comparing 20 and 21. So you can see the percent changes in the major areas. We had fewer homicides in 2021. Our sexual assaults, rapes, there was a slight increase in 2021 from 2020. Our robberies were down slightly. Aggravated assaults were down slightly. Burglaries were down. Our larcenies, which is theft, was down slightly, and vehicle thefts were down as well in 2021. I want to talk a little bit about the gun violence that we've experienced in 2021. Starting the past summer in July, we started to see a pretty big increase in the calls where firearms were being discharged. What we started to do to try to combat that is we started to look at new data procedures that made sure we documented all these shots fired cases so that we didn't let any slip through the cracks. The last 5 months of 2021, we had a total of 34 events where shots were fired, which has been higher than in previous years. So what we did is we reached out to some of our federal partners And we're going to start, and we did start enhancing our investigations where we brought some of those federal agencies into those investigations. One of the main things we started doing was every time we had a shots fired called, any kind of evidence that we collected, whether it be a shell casing, a bullet fragment, or a weapon itself, we made sure that we got those pieces of evidence analyzed so that we could see if they were connected to other crimes that had been committed using that same type of gun or that same ammunition. Also noted, anybody that we had found in possession of a firearm where they were a criminal suspect, that weapon was also submitted for laboratory analysis to see if it had also been used in previous cases. And the reason we were doing this is we were trying to link people with crimes. What we started to find this past summer is that we started to see the same individuals were involved in some of the different shootings that we had around the community, and we wanted to make sure that we focused our attention on them so that we could stop some of the gun violence. Aggravated assaults, this is the third year in a row that they've decreased. They only decreased by 1%, but that is still a decrease that we are happy with, because in 80% of cases, the victim and the suspect know each other, and 60% of those aggravated assaults occur in a residence, which it's hard for us to know about, and a lot of times hard for us to do anything about. So having a decrease in those is something that we're happy about. Crime in perspective, overall, the crime rate for the city dropped 9% in 2021. Violent crime decreased by 1%. It's important to note this, that violent crime usually is not random. It's usually someone who knows someone. And in 80% of our cases, the victim knew who the assailant was. So some of the things we've done is we've worked with social service agencies and advocacy groups and launched educational campaigns to try to get people to work together, communicate, instead of resorting to violence to resolve disagreements that they might have. Traffic stop data. Traffic stops in 2021 decreased over 2020. As you can see, the historical chart, they've decreased significantly since 2018 each year. And we're focusing more on violations where people could get hurt or injured, where there's a significant safety risk, where people are driving vehicles recklessly or something like that. That has started to become the focus of our traffic enforcement. Talk about our records division. You can see the comparison in 2020 to 2021 on major areas that they handle. Public access requests are a big thing. Those increased in 2021. Criminal history requests decreased some, handguns decreased some, accident reports, there was a slight increase in those. And initial case reports decreased in 2021 over 2020 as well. Monroe County Central Emergency Dispatch. You can see the breakdown in calls for service for all of the agencies that the dispatch center dispatches for. The Bloomington Police Department has the most calls for service, followed by the Sheriff's Office, then the ambulance service, and then the Ellettsville Police Department. The fire departments are also listed in there. In 2021, they processed 115,381 calls for emergency services and 125,925 administrative calls. That's a lot of phone calls that division handles every day to make sure that the proper public safety resources are getting where they need to go. A little bit more about Central Dispatch. 3.5 new positions were added in 2021. 3 were added in 2022. And this is a continuation of an organizational assessment that was done by the Novak Consulting Group a year or so ago. So our total personnel, we have 32 dispatchers. We have 6 dispatch supervisors, a telecommunications supervisor, and assistant telecommunications supervisor as well. Talk a little bit about CALEA. I'm extremely proud of the fact that we are one of a few agencies, not only in Indiana, but across the country, that are accredited. We first obtained accreditation in 2018. In March of this year, we will be undergoing a complete reaccreditation that takes place every 4 years. This process will have examiners reviewing all of our policies and our procedures and all of our activities to make sure that we continue to meet CALEA's rigorous standards for their organization. Talk a little bit about our police social workers. We were fortunate in 2021 to be able to add 2 more. So we have a total of 3. You can kind of see the breakdown in the referrals and the calls and things that they handled. We had a total of 369 in 2021. They averaged about 31 new referrals each month. Second shift was our busiest shift, with those officers making referrals to our social workers. And this screen here shows the total interactions that the social workers had with people in our community. In 2021, they had 3,597 total interactions. An interaction can be a variety of different things. It can be a referral that an officer makes. It could be someone who's reached out on their own to talk to some of our social workers. It involves our social workers making contact and then following up a lot of times with individuals that they have talked to. It's been a very successful program for us with regards to diverting people who have mental health issues or other issues out of the criminal justice system. But it's the biggest positive out of this is the social workers are able to refer people to services to get them help so that they don't actually need to call the police or public safety to help resolve issues for them. I'm also very proud of the fact that we hosted in October of 2021 the first national conference on police social work. We had 115 people from 19 states that came to Bloomington for a 3-day training conference. We got a lot of positive feedback about this, and we will continue to host a conference this year and in future years because I really believe that this is a growing trend in public safety, having social workers embedded in police departments to help deal with the calls that agencies get. Our community service specialists are non-sworn people in our department that take minor reports for us. They work a lot of traffic accidents. They do traffic direction. They take reports on minor crimes that are not in progress. We have looked at the data. They are actually handling about 4% of our call volume, which is a good thing because that actually frees up the police officers to do more, handle more serious calls, and they're not getting bogged down in calls that tend to take a little bit more time. In 2022, we also are adding 4 more community service specialists to our ranks, so that will bring a total of 8, and that will allow us to expand the number of hours that they are actually able to assist the officers in their job. I want to talk a little bit about the Stride Crisis Diversion Center. It is not something that is run by the city, but it is actually ran by Centerstone, but it is something that is a huge benefit to the city. The city of Bloomington was instrumental in helping get Stride going. It is a emergency crisis center. We are able to refer people to Stride rather than take people into custody for minor types of offenses. You can see in the numbers, BPD was responsible for over half of the referrals that the center has gotten. And again, these are for low-level nonviolent crimes. It's people who may be experiencing some kind of mental health emergency, and they need that assistance and that treatment rather than being taken into the criminal justice system. And this has been a very good partnership that all the law enforcement agencies in the county have been able to have with Centerstone and the professionals that they have there working and managing the day-to-day operations of it. Talk a little bit about public engagement. Our public engagement numbers were down again this year. COVID-19 has pretty much stopped a lot of what we were able to do. You can see on the right-hand side of the screen, there's a list of things that we have done in the past. That was a lot of those were not done in 2021 because of COVID-19 and wanting to keep people separated and not at risk of catching it. One thing we did do though was we had our Citizens Police Academy, where we invite citizens in to learn about pretty much every aspect of the police department. On the list are some of the things that were talked about, but it gives community members an opportunity to hear from individual officers, ask questions, and get a better understanding of what we do as police officers in the city of Bloomington. As part of transparency and data sharing, we share information with two different sources. We were one of the first agencies in Indiana to share information with the police data, the police data initiative. It's administered by the Police Foundation. We share 16 different data sets, which are listed on the right with that organization, and it is part of a national organization that has data from police departments across the country. More locally, we also share that information on the city's Be Clear open data portal, which you can find on the city's website. And again, it's 16 different data sets. Those are listed on the right. It covers a lot of information where people can get in there and just see what type of, for instance, calls for service we go to. There's information on there on hate crimes and a variety of other things. I want to talk a little bit about the Board of Public Safety. This is a 5-member civilian board that is appointed by the mayor that oversees the police and fire departments. The board meets monthly and they receive information from both police and fire departments. We do, if you see on the right, some of the stuff that we include, we do monthly training reports. We go over crime statistics. We talk about personnel matters. We report monthly to them the deployments of the Army Armored Rescue Vehicle, which we had 2 in 2021. And we also provide budgetary updates. Fire department does the same thing in their part of the Board of Safety meeting, but this is a public meeting open to the public for them to review a lot of different aspects of the police and the fire department. I want to talk a little bit about officer wellness and what we've done. Officer wellness is one of the pillars in the President's Task Force on 21st Century Policing. Our goal is to focus both on the mental and physical wellness of our officers. Healthy police officers usually result in fewer problems that we have. And so we've invested heavily in trying to keep our officers physically and mentally healthy. Some of the things that we have done is we've started a peer support team. Our police social workers are available to meet with officers who might need to talk about, a call or talk about something that's going on in their life. We have a police chaplain program, and they are also available to talk to officers and work with them to just kind of be a listening person if they have issues they want to talk about. We created a new physical fitness facility in 2021 that is state of the art. We have a lot of cardio equipment, weight training equipment, so the officers can use that facility. The other thing we started in 2021 was we hired an athletic trainer and who was actually embedded in the department, who was able to work with officers who might have had a minor injury on or off duty to try to keep them healthy so that they're able to continue to work. We also, the city also participated and provided COVID vaccine incentives to our officers to help keep them vaccinated and safe from the COVID-19 issues. Some of the challenges, COVID-19, obviously, the pandemic was a big challenge for us. We had to institute divisions where we separated the units within the department so that there was less contact, personal contact, which would help slow the spread of or transmission of the disease. We went to virtual roll calls and limited physical meetings so that we just weren't near people. We isolated our civilian units. We wouldn't let people go into records or into dispatch, so that we did not have any kind of cross transmission of COVID. We also did a lot of decontamination of equipment. We provided hand sanitizer and cleaners for cars, and a lot of masks that officers wear. And again, the whole goal was to reduce the possibility of spread and keep our people healthy, but it has been quite a challenge. The other big challenge we had in 2021, and as the fire chief mentioned, we're right across the street from each other. We too had a significant flood damage to our building from the storm in June of 2021. We had to basically vacate the entire basement of our facility where our detective division is, our evidence is, and our athletic trainer was housed due to the damage. It totaled in excess of $300,000. It has all been fixed. All of those people that were out of our building for approximately 6 months are now back in the building, but it did disrupt operations quite significantly while we were managing the damage from that storm. Talk a little bit about 2022. Again, we want to use data-driven policing to reduce crime. We want to hopefully be able to expand our engagement with the community. And we want to continue to be as transparent by providing the data sets to the city's website and to the police data initiative. Our goals also are to recover from the COVID-19 pandemic and return to normal operations. We want to continue to provide high level of community-based police services, and we are going to continue to address the rise in violent crime by working with our partners in the criminal justice system and with the community as a whole. Personnel additions for 2022, as I mentioned earlier, we're hiring 4 more community service specialists, which will bring the total to 8. We are hiring, or we are going to expand their hours to work hopefully from 8 a.m. to 2 a.m., which will give more coverage and help free up the sworn officers for more emergent calls. And we have also added an additional crime analyst to the budget so that we can have more eyes and work more thoroughly on our data and looking at patterns that will allow us to better address any rises in crime. The other thing I wanted to touch on for 2022 is we've also in the budget in 2021, their budget, there was a $5,000 bonus that was instituted for the last quarter of 21 and for 2022 to help recruit officers and to also help retain officers that we currently have. We've also started to look at take-home cars and expand the take-home car program so that officers who have a take-home car are more able to quickly respond to any type of emergencies we might have. And we've also continued the housing incentives for those who rent in the city and those also who are looking to buy housing within the city limits. 2022 will also continue to participate in the variety of diversion programs that are in the criminal justice system. Those are listed there on some of the different things that we've done with the pre-arrest diversion site and release, our downtown resource officers, the crisis intervention training, mental health first aid, and all of the problem-solving courts that we work with in the system. That concludes my presentation. I will now turn this over to Beverly Calender-Anderson, who is the Director of Community and Family Resources.
Thank you, Chief Diekhoff. And I want to thank Chief Decoff and Chief Moore and their departments for everything they do. Before I get started on my presentation, I do want to take a minute to thank the CFRD staff, to thank our volunteers on commissions and task forces and committees, and also the staff and the boards of nonprofit agencies. A lot of those agencies that we work with, that we just couldn't do a lot of this work without them. And so wanted to take a minute to thank them. And so now I'm going to share my screen. I think. There we go. When we did this report last week, we left with some goals for 2022, and I just wanted to give you a bit of an update about that. We now have public restrooms available 24 hours a day, 7 days a week, with the opening of the 4th Street and Trades District garages. And what this does, this was our final recommendation from the Safety, Civility, and Justice Task Force in 2019. And so not only does it complete those recommendations, but it also makes available this really important facility for people living and working downtown and visiting. Chief Diekhoff has already told you about the Stride Center Crisis Diversion Center, and that is open, and just want to thank Centerstone and their staff for having this really vital service for people in our community who are experiencing crises. Last year, we introduced our partnership with Bloomington Health Foundation, helping Bloomington Monroe. And this online portal gives people in need and their helpers access to resources 24/7 and through online. And our department is continuing to provide training and support for nonprofit staff whose agencies are a part of this network. And if you're not familiar with Helping Bloomington Monroe, or if you haven't visited it for a while, you can access it at helpingbloomingtonmonroe.org. And as the COVID pandemic continues, we've continued our role in supporting increased communication and coordination with those agencies providing services to Bloomington's unhoused residents. In addition to weekly meetings with shelter providers, we're also managing the Downtown Outreach Grants, which support services to unhoused residents or those in jeopardy of becoming homeless. And so that's another thing that we've continued. We started that in 2021, and so are continuing it this year. And lastly, for this slide, we have a new after hours ambassador who came on board just as restaurants and other venues began reopening downtown. And he has hit the ground running, getting to know restaurant and bar owners downtown, responding to situations that could use some de-escalation, and helping to plan with the flow of major events downtown. So I will talk about all of these a little more during my report, but just wanted to bring that up to date in case you are looking at, last year's report. So I talked about the safety, civility, and justice recommendations, and this slide shows those recommendations. These are the things that have been instituted. Increasing programming at People's Park. We implemented a mental health first aid and mental health 101 training, helped Shalom Center expand their programming through the weekends. Our Parks and Rec department has a program that employs Centerstone clients, helping them learn job skills and earn income. We've published homelessness resources, increased lighting, and the very last one, as I said before, are the public restrooms that are now available in the two. I don't know why this keeps going back. Hold on, I'm trying to figure out how to get it back. Anyway, available in the 2 downtown garages. So I'm just gonna stop touching things right now. The 4th Street garage and the opening of the 4th Street garage and the opening of the Trades District garage has enabled us to have these restrooms available 24/7. The facilities are monitored. They're equipped with industrial grade fixtures that can withstand high volume usage. And these fixtures decrease the chance for damage. The restrooms are also going to be equipped with sharps containers, but those are on order, so they're not quite there yet. And to talk a little bit about, I really do want to go back, but I'm not sure how to do it. Okay, hold on. think I figured it out. Okay. There we go. So talk a little bit about helping Bloomington Monroe, and that's the online portal. In 2021, we had 5,026 searches, and you can see from these charts, looking at the 2020 searches and the 2021 searches, housing resources still account for a lot of the top 10 searches. But in 2021, it was 36% of the overall searches on the site. And that was a slight increase over 2020, where it was 33%. Food resources are still being sought largely, but they've gone down a little bit with the increase in the searches for housing. The search volume also varied from 2020, when searches started out high. In 2020, they started out high at the beginning of the pandemic and then reduced throughout the year. In 2021, the searches started relatively low, but they spiked in November and December. And one of the significant results that we saw in 2021, which is the second year of the pandemic, is the need for more social and human service support and resources. So it's notable that in those top searches, that searches for support networks came in at number 9, mental health resources at number 12, and financial aid and loans at number 13. So it's showing what we think is the impact of the pandemic on the needs of people using this resource. Our downtown outreach grants, that's what we're going to look at next. These grants support projects that will improve the human condition of Bloomington residents who are unhoused or at risk of homelessness. Each year we have $250,000 to distribute, or at least in the last 2 years, a portion of which is designated for unforeseen emergencies, but the majority of it goes out to agencies. And as you can see from the requests in 21 and 22, those requests far exceed the amount that we have to distribute. Our 2022 grants are currently being evaluated, and those results will be announced next week. But in 2021, you saw that there were $436,243 in requests, and we awarded $243,758. This year, we have $340,145 in request. And so, like I said, that'll be announced next week, but you can see the kinds of things that these grants fund. And so helping to fund the weekend hours at Beacon or the weekend hours at Shalom, and the outreach program for Beacon, outreach programs for Centerstone, employment supports, vaccination and clinics for animals belonging to people who are unhoused, emergency pet services, emergency hotel stays, intervention services. And so these are the types of programs that this supports and will continue to support in 2022. And to our after hours ambassador, we started, Charles Culp is our after hours ambassador, and Charles came in and really hit the ground running. Like I said earlier, restaurants, bars, theaters, all those venues were beginning to open as he started, and the need for his services downtown really became apparent. And he does everything from help visitors find their way to various venues during large events, make recommendations for restaurants or things to see in Bloomington. He helps to support unhoused residents by getting them to needed services. And sometimes he just makes inquiries about some downtown regulars that may not have been seen for a while, and just sort of keeping eyes and ears open downtown and knowing what's going on. He has become a very trusted go-to person downtown, with people calling him, not only with requests, but sometimes for advice. And so, like I said, it just seems to be that person that has been needed in the downtown area. And you can look at the chart to see where the bulk of his time has been spent since he's been on board now about 8 months, I do believe. And next, I will talk a little bit about the Divided Community Project. We continue to be a part of the Divided Communities Project. We started about 3 years ago with the Moritz College of Law at Ohio State University. And we are now a part of their Thought Leaders Collaborative. And this group is comprised of national leaders in the area of conflict resolution, crisis prevention, and management. One of the recommendations from our local team that was trained through the Divided Communities Academy was to create a Future of Policing task force. And this task force, it's about 10 folks that made a 2-year commitment. They began meeting June of last year, and they met weekly through the summer. They've conducted focus groups. They've done ride-alongs with BPD officers, met with our police social workers, researched innovative policing in other communities. They're working really hard to make recommendations about what policing should look like in the future in Bloomington. And so I really want to thank them for their work. They have worked very hard, and it's evident that they care for our community and our residents by how meticulous they are in how they do their work. And so I want to thank task force members Carolyn Calloway Thomas, Kevin Ferris, Ayami Jocelyn, Trayon McClendon, Malik McCluskey, Amy McKees, David Norris, James Sanders, Councilman Jim Sims, and Garfield Warren. Again, like I said, they met through the summer. They've given a lot of time and effort to this and are doing a lot of work. The task force is also resourced by Marissa Parr Scott from the Community and Family Resources Department, Chief Diekhoff, and myself. And so you can look forward for recommendations from that group, for at least initial recommendations soon, but then they also have about another 1.25 years to work. So looking ahead, as we go into the rest of this year and the beginning of next year, we are going to be creating an after-hours volunteer corps. Right now, our after-hours ambassador is just one person, but to increase his capacity and the capacity to continue to make downtown hospitable for all residents and visitors, we're going to create an after-hours volunteer corps. In partnership with Monroe County United Ministries, we plan to stand up helping Bloomington Monroe kiosks in heavily used locations, and that will make this resource more accessible to people who use it most frequently. We are going to provide a second round of mental health first aid and mental health 101 trainings for community members. The last time we did this a couple of years ago, we were able to have 197 people in the community trained. And so we hope to do that again. And for some people who may want refreshers or people who did not get a chance to participate the last time. And lastly, we're developing a job readiness project for those who were formerly incarcerated or unhoused and are ready and able to work. So that's where we're headed. And hopefully next year when we come to you, we can update you on all of those initiatives. And so I thank you for listening to the presentation. Sorry for the technical glitch. And I want to turn it over to Mary Catherine Carmichael in case you have questions.
Thank you, Beverly. That's great. We appreciate it. We're a little over time already, but we're happy to take questions. If anybody has questions for Chiefs Diekhoff or Moore or Director Beverly Calender-Anderson. I'll give you a second. You can just put those in chat. Okay, we've got one for Beverly. Just anecdotally, Beverly, everything you described about Chuck as the After Hours Ambassador program sounded spot on based on the several occasions I've run into him while he's been on the job. Is there any thought to expanding the After Hours Ambassador program to a more general kind of ambassador program outside downtown and maybe also during the day?
So right now, and thank you for that. And I hope that Charles is listening so that he could hear that response. Right now, we're looking to expand it in the downtown. I can't say for the future. We may. It looks like it's going well, but I think we want to continue to keep it downtown for right now until we have it. I won't say perfected because it'll never be perfect, but until we get a better handle on it, and then we may look at going outside of the downtown area.
Okay, thank you. Can we get a quick update on the status of BPD collective bargaining? That is, have the bargaining teams continued to meet, and are there are there future meetings scheduled? Chief?
Yes, collective bargaining is still ongoing. We are making progress. And that's probably all the lawyers would want me to say.
All right. Thank you. All right, Chief Moore and Mayor Hamilton. Is a single unified fire protection agency for all of Monroe County a goal worth pursuing? And if so, hold on. Sorry, things are moving around pretty quickly here. What are we doing specifically now to try to reach that goal? And Chief Moore, let's start with you on that.
Yeah, great question. So we are constantly working to improve our working relationships with our mutual aid partners. Until we were even get to the point where we are fully in sync with mutual aid, I think it would be ill-advised to start moving that direction. But we're always open for option suggestions. I will point out that legally, the legal mechanism for mergers of what you're discussing are very complicated. And I don't know how it would work in Monroe County.
Mayor Hamilton, do you have anything to add to that?
Nope, Chief Moore covered it. Thanks.
Okay, I'm going to give you a shot at it. Thanks. All right, Chief Diekhoff, you're back up. Is the shots fired data that is being collected in a data set somewhere on the Be Clear data portal?
No, it's not currently, because it is something that we're trying to make sure we gather all the information because those types of calls come in a variety of different ways, and so we're still figuring out how best to capture it and present it in a data set.
Okay, thank you. Chief Diekhoff, stay with me. Are we in fact seeing more situations that are mental health calls for service, or do you think the fact that we've added 2 additional social workers to the police department might be having an impact on those numbers? That is, if we know that we have someone who is specifically trained to deal with a mental health issue, we might be more inclined to call that a mental health call and not just a disturbance. What do you make of the statistical increase? Can it be blamed on COVID fatigue? A lot in it.
There's a lot in that question. Yes, I think we are seeing an increase in mental health calls. I think that not only in our community, but nationwide, people are under a lot of stress with a variety of things that are going on. I think that it could be true. I don't have any evidence of that because we've expanded how we respond to mental health calls and we have social workers, it might be true that people are calling because they need those resources. That would be hard to kind of, I think, figure out. What else was in the question towards the end?
It did talk about the COVID fatigue, and what do you make of the statistical increase?
Again, I think for a long time, mental health stuff really wasn't out in the open, and it's becoming more the norm to discuss that. You can see public safety agencies across the country that are adding specialty units to address those types of increases in calls. And I think we've experienced it locally too, where we've seen an increase and where we too have created units to deal with those calls that we receive, because it's not really a police issue. It's more of a public safety issue. And so having the social workers, having our DROs, having the Stride Center, having the Downtown Ambassador, those are all responses that I think we can be proud of that we've come up with to deal with those increase in calls for mental health problems.
Thank you. And thanks to everybody who participated today. We appreciate your participation. This has been live broadcast on Facebook. It'll be available there for you to review. I imagine there will also be a transcript available for this. We'll put something up about that as well. So thank you to each of you for attending. Thanks to for all the great questions. And we will have these available on our website as well. Access to the reports in today's video is available at bloomington.in.gov, Public Safety Annual Reports. So thanks again and have a great rest of your day.